So I'm a psychiatric provider in America, and in America we do an awful lot of talking about our rights. What we don't talk about nearly as much, and I wish we would talk more about, is our responsibilities. And how that kind of comes into the mental health world is you have the right to feel however you want about things. Things can happen to you, and you may not even be able to control how they make you feel, but you are entitled to those feelings, right? But you have a responsibility to how you react to them. So you are still responsible for your actions and your behaviors. So your emotions can get big and they may make you angry, but what you do with that anger is still your responsibility. And there are disease processes that make it much harder to control those things. And in some of those bigger, kind of more substantial mental health processes, yeah, that responsibility gets a little bit fuzzier. But what I get really frustrated with is people who will say that I did X, Y terrible thing because of my ADHD or because of my anxiety. And overwhelmingly, that's not true. It's just a maladaptive coping mechanism that needs to be addressed. And that kind of goes back to the feeling and function part that I talk about in a lot of my discussions with my patients, is that there are two parts to every mental health issue. There is the feeling part, which is what happens on the inside, and the function part, which is how it affects the world around you. And unfortunately, out in the world, the function part tends to get a lot more a lot more press because that's what everybody else sees. And both of them are very important. You, like I said, you are very much entitled to how you feel about things, but you still have that responsibility to your behavior. And if you're having difficulty managing the behaviors that are associated with your feelings, well, that's what people like us are for. So come chat with one of us and we will try to make your life a little bit better.